Thanks, Fee. And I want to say how much of a pleasure it is for me to be here. I did a talk for a Scleroderma group years ago when I started my career at Penn, at the University of Pennsylvania Hospital, with Dr. Jimenez. And so it's a pleasure to address you today, and also to be invited by Fee to accompany Dr. Osterman here. So my talk is going to be on therapy for Scleroderma. And we've heard, and you're all aware of the problems that are relevant for a hand therapist to address, and including skin tightness and swelling in the hands, joint stiffness and loss of mobility, soft tissue and joint contractures, and then the change in hand posture that we've already heard about and that you're all aware of. The MP joints are held in extension with the flexion at the PIP and DIP joints. Contractures typically involve the MP joints in extension, the PIP and DIP joints, and the thumb web space.
I'd like to turn the projector back. I'm sorry. Just give me 1 second to go back up. Sorry. Sorry, folks. That was my fault. I turned off the projector.
That's right.
So just a...
Right off the bat.
Yes.
It's been a long time since anatomy class.
Okay.
What's
what? Everybody look at their hand. Okay, and where your finger is starting out from the hand itself, you have one joint, it's the MP joint. So the metacarpals are the bones in the hand, and then each of the subsequent 3 bones are the phalanges. So the MP refers to the metacarpal phalangeal joint. Then you have 2 IP joints, interphalangeal. So proximal is a relative term, it means closer to the heart. Distal is further away, so it's PIP and DIP.
So it's knuckle.
The knuckle, you can refer to that as the knuckle, it's the MP or MCP.
Then the
PIP and then the DIP. And in scleroderma, what is typical is that the MPs lose the ability to flex. Flex refers to bending, and straightening up is referred to as extension. And so the typical posture is the loss of MP flexion, and then with these up like this, there's sort of a compensatory reaction where the PIP and DIPs pull into flexion. So those are the typical things. The other thing is that the web space. Web space refers to the thumb, where you can open your thumb out to grab an object. It also refers to the web spaces between your fingers that allows you to spread your hand wide. And so those are also affected with scleroderma, with tightening and loss of those web spaces. So, and then we've heard about Raynaud's phenomenon, skin breakdown in the ulceration, and calcinosis. And then, of course, limited endurance, and then the difficulties with activities of daily living that you're all familiar with. So how can therapy help? How many people have had the occasion to go to a hand therapist? Okay, so you're all pretty much familiar. The focus of therapy for a hand therapist is first and foremost to try and help you preserve your mobility or maintain it, to prevent loss of mobility as much as possible. And then in instances where the loss of mobility may be related to a period of inactivity, to restore mobility to the extent possible when it's a recent loss and, as I said, the result of inactivity. And then the other focus is to help you achieve the greatest independence in activities of daily living and work through adapted methods and ergonomic and assistive devices. And so, as Fee said, I brought a couple little samples of things that you're welcome to take on your way out, little bottle openers, as well as some adapted pens. So help yourself if you find them helpful. The other thing that we will work with you on is to help you learn how to preserve and protect your skin from ulceration to the extent that you can, to help you learn some techniques for controlling the symptoms of Raynaud's, and then to also provide education regarding energy conservation, work simplification, and general healthy living. So what do you expect? Well, when you first come in to see a therapist, there is an initial evaluation that's done. And the first part of it is the therapist will sit down and talk to you about the history of your scleroderma and how it's affected you in terms of your hand mobility and your function over the recent past. In particular, we're going to look at the impact that it's had on your ability to perform your daily activities and to fulfill the roles and responsibilities at home as well as at work. And then also we'll want to know what prior therapy have you had and other things that you have found helpful or not helpful. Then the therapist will sit down with you and really scrutinize and look at your hand and basically do a descriptive assessment and document what is seen. The hand posture, your skin condition, and which joints and soft tissues are affected and vulnerable. For example, if there's evidence of PIP contractures that are starting or evidence of flexion limitations at the MP joint. And we'll do baseline measurements. So this is, I think, very helpful for patients because when you come in, we're going to take measurements of your motion, strength. I'll show you a few of these things. So that it serves as a baseline. And then you can come back in 6 months or a year. Or if you have a sense that, oh, you think maybe something is changing at all. We have documentation of measurements. So that would include range of motion of the wrist, the fingers, and the thumb. We measure the web space and the finger span. We look at hand strength testing using gauges for grip and pinch. We look at touch threshold to evaluate your sensory perception and discrimination. There are dexterity tests that are done that evaluate your coordination, your ability to manipulate small objects. We'll do a complete inventory with you of your activities of daily living so that you can sit down with us and think about what things you have the most difficulty with, and then in the treatment planning process we'll problem solve with you to see what we can do to help things get easier for you. And then, if appropriate, a job analysis so that we can look at how you're functioning at work. And so these are examples of some of these assessments. So, whoops. Over here we have this goniometer. It's like a little angle device where we're measuring the angles that are made with your fingers when you're flexing and extending. And so we have very precise measurements that we can look at, say, 6 months to a year later. We'll test grip strength. Computerized grip and pinch measurements are done. And this is a handheld dynamometer, so it evaluates your hand strength. Swelling measurements. This is just a simple displacement of water, or we'll do circumferential measurements as part of the baseline. We're looking also at your ability to perceive light touch. So this is analogous to like a hearing test where we're looking at what your hearing levels. This is what the lightest touch is that you can perceive. And we use these pressure-sensitive monofilaments. And then we look at patterns of hand grasp and prehension. Grasp meaning we're referring to gross grasp. Prehension refers to small finger or small joint manipulation of small objects. And I think it was Elaine I was talking to, your granddaughter calls it gription, which I think is a good term. Gription. Then we'll do the ADL inventory. We'll actually have you simulate the things that are most difficult to see if we can determine what's causing the difficulty, which will then help in the treatment planning process. And we're going to be documenting all of the observations and measurements. And so the treatment planning process involves, basically sitting down with our patients and jointly coming up with the goals of the treatment. The first is overall, it applies to everyone, the achievement of the highest level of independent function in activities of daily living and work. And then secondly, to protect and preserve those vulnerable structures, particularly the skin and the joints. So knowing what those vulnerable areas are, the MP joints, the PIP joints, the web spaces. We know that those are vulnerable to contracture and shortening of the skin. So those are things that we're going to really key into in terms of the treatments that we recommend and the exercises. In cases where there's been a recent loss of function, we may have some success in helping restore some degree of motion or function, and then also figuring out what things we need to help you do to compensate for the loss of function. So each patient is different. Each patient has their own daily activities and roles and responsibilities, and so we're going to focus on those things, whatever it is. If you have difficulty handling your toothbrush or pulling up your clothes or doing fasteners, and then if you have avocational activities like fishing or whatever you want to be doing, those are the things that we'll focus on in therapy. So what are the interventions? What are the tools of the trade? Well, therapeutic exercise certainly first and foremost, to preserve mobility, to prevent loss of motion, and then to restore motion, if at all possible. Orthotic intervention or hand splints. How many wear hand splints? So you're familiar. And typically the splints that are needed for patients with scleroderma are custom fabricated orthoses that are made by a certified hand therapist with the low temperature thermoplastic because of the unique aspects of the scleroderma hand. We'll do ergonomic and assistive devices that will recommend these things and adapted methods to help you be independent in your activities of daily living and work. We'll instruct you in protective techniques and care for the skin, and then relaxation techniques and healthy lifestyle habits, which are very important, particularly in the area of Raynaud's phenomenon. So let's talk about exercise. Basically, it's important to do exercise every day, as a maintenance type of thing. And the exercises are targeted to address those most vulnerable joints that we talked about, the web span of the thumb and the fingers, MCP joint flexion, and PIP joint extension. So these are just starting out with some general exercises, and if you all want to do this, go ahead. You start out with full finger extension, straightening or extension, and then a half of a fist or a hook fist looks like this. It's not a full fist, but a hook fist. And then moving into a full fist, and then this straight fist where you're trying to touch down on your palm as far as you can. When you do this last one, what that requires is a fair amount of MP flexion. So you want to, really focus on that, and then straightening back up. And so this is kind of a general routine that you can do, and it's important to do daily, probably twice a day, morning and evening, to maintain your mobility. Now let's look at these targeted exercises. Remember, we said the MCP joints are these knuckles. So when you're working on or you're focusing on those, you want to have your wrist straight, and you're going to flex your MPs down as far as you can. So you're looking at like a 90-degree angle is the max, and that's what you want to do, and then coming back up. So if you do that every day, twice a day, maybe 5 slow repetitions, that's what you want to do. It doesn't help to just kind of wiggle back and forth. You have to do this mindfully, taking a term from the meditation literature. It's mindful, careful, attended exercise. Finger extension, you can get a rolling pin. And this is for your PIP joints and the DIP joints to encourage extension. So a rolling pin, or just even flattening your hand flat on the table to the extent that you can. And then web stretch, stretching out your thumb from your palm and your fingers. And then if you put your hands together, you can actually just do a self-stretch by putting the fingers through the other fingers of the other hand and your thumbs to try and stretch that open. And then a web stretch. One thing you can do is you take a wine bottle or a baseball bat or something that's narrow at the top and wide at the bottom, and then just grab onto it at the top and then slide your hand down, trying to keep the web space in contact with that bottle, and that'll help to stretch that out. And then for wrist exercises, basically the wrist moves in 4 directions. You're going to move your wrist into extension, and then flexion, and then move side to side. Grip strengthening. Now, one thing I want to say is that one thing you don't want to do repeatedly, which a lot of people do, and it's sort of something that everybody advises you to do, is to get a ball and to squeeze it. How many people do that? Yeah, so one of the things you want to avoid is repetitive gripping. If you think about it, if your fingers are having difficulty straightening up at the PIPs and you want to do you're doing repeated gripping, you're not really doing enough to open the hand out and preserve that finger extension. So be careful in terms of the exercises you do, and don't overemphasize things that might encourage more of that flexed posture. Make sure you balance it out with finger extension, MP flexion, and then light grip. So the exercise is at least twice a day. It's important to do them, and try to do it with a sustained end range positioning so that you're trying to stretch a little bit at the end of the range of motion. You want to avoid forceful pressure on the joints. It's certainly not appropriate, the no pain, no gain philosophy. You don't want to be pushing on the joints because you're likely to instigate some tissue response and pain and swelling. So just be careful with avoiding forceful pressure. It sometimes is very helpful to precede exercises with neutral warm. So sometimes just doing them when you get out of a nice warm shower is helpful. And then paraffin dips have been found to be very soothing and very helpful for improving the range of motion and reducing stiffness. But it's important to be careful with this because not everybody can tolerate the heat of the paraffin. If you have open ulcers or fingertip ulcers, then you certainly don't want to do that while those are open. And one thing that's been suggested is if you get those loose plastic gloves like they use in the deli, like food service workers, put that on your hand first and then you can dip into the paraffin and you get that nice warmth without it being too warm. And so there was a study looking at the use of paraffin and exercise on hand function in people with scleroderma. And they looked at function after 8 weeks of daily paraffin and hand exercise. And using different types of measures like the DASH and different self-report measures, they found that there was significant improvement in those scores as a result of this. So the point is just a daily practice of stretching, which everybody should do, but it's very important when you have scleroderma. And this just shows the paraffin dip. These, incidentally, you can get these at the General Nutrition Store or Sears or Bed Bath & Beyond. They sell these, and they're very convenient. You keep them. Do you have one? Yeah.
I use one every day.
Do you use it every day?
Every day.
Anybody else use paraffin? Yep.
I had it when I broke my finger.
You loved it. For those that, do you have to use a glove or anything? Is it very hot for you? Or?
I have temperature different. You can
Oh, you do?
with
Okay.
low, medium, or high.
Okay.
And then I dip them 4 times and let the wax build.
Uh-huh.
And then I put a plastic glove
Over top.
And then I have these little mittens that
Uh-huh.
I put over that.
Sounds perfect.
And then I just go to sleep.
It sounds very relaxing. So that sounds good. And then when you take the paraffin off, that's the perfect time to do those exercises.
Yeah, and my question here is, I was taking the paraffin wax off,
Uh-huh.
and then I was squeezing the wax while it was soft
Okay.
as an exercise.
I probably wouldn't necessarily do that. I mean, I think if you're seeing a therapist, ask them to recommend some exercises. If you had trouble straightening up, then that would not be what you'd want to do.
Okay.
You could take your paraffin and roll it into a rolling pin type motion.
Okay. Thank you.
All right, and then the next area that we're going to be looking at is splints or orthoses, custom fabricated orthoses. And these can be very helpful in a variety of different situations. One purpose is to maintain motion through positioning. And we specifically look at those positions, the MP flexion, the IP extension, and the web span. So these could be custom made for you. They maybe include the wrist, maybe not. And then they can be worn at nighttime. And if you have involvement on both hands, then maybe you use one night and one the other, or you don't use them all the time. So it's something that is helpful in terms of maintaining your posture. If your posture is wanting to be in this position with your thumb close to your palm, you want to really break that up and try to get out of that posture for periods of time, and that can be helpful in maintaining the web length and the range of motion of the fingers. So, and these typically, need to be custom made. They should be custom made by a certified hand therapist, and they're adjustable so that if you find that you get them and they don't fit properly and they're uncomfortable, make sure you get back to your therapist and say, this is not comfortable, and they will remold them. So, and also incidentally, make sure you're seeing a certified hand therapist, and I have more information about how you find a certified hand therapist at the end. This is an orthosis used to stretch out the web space and to maintain it. And the thermoplastic material is such that it's not like plaster where once you use it, you're done. The thermoplastic material can be reheated and remolded. So oftentimes we're doing this on a regular basis to serially try to stretch out the web space. But at the very least, I think it's helpful in maintaining things. And then dynamic splints are used sometimes if we're trying to specifically gain some motion. And there's limited success in these, but if in the evaluation we've determined that you really could use another 10 degrees of MP flexion on the radial side or on the thumb side of the hand, then this might be something that we could try. We would take the angle measurement first, we make the splint, have you come back in a week, take the measurement again, and really, see if we can specifically gain a little bit more motion to help you with the specific functional activity that's involved. These splints also, incidentally, are used following surgery. This would be one that might be used after a joint release procedure to try and maximize the benefit from the surgery, used for intervals of time after the surgery. These are little cylinder orthoses that are used to protect healing ulcers on the dorsal aspect on the back of the PIP joint, and these can be very helpful, and they're applied over a light dressing with whatever topical that you might be using. And then painful ulcerations or calcinosis. Little plastic cap splints are used, and there are also other types of things that can be used for this. But these can be very helpful. When you have these little ulcers and calcinosis, I'm sure you find as you're using your hand in your ADLs, you're always banging it, and just it seems like it just keeps it irritated. So it's something to think about as to how you can protect your hands during your activities. And then these are for postoperative protection. This is a patient who had some fusions of her PIP joint. So we'll make these little individual thermoplastic splints with Velcro, and they're applied over the dressing. And they're used for protection until the fusion is established. Skin care is another thing that is important to observe or pay attention to. Moisturizing the skin several times daily to relieve dryness, using a topical product like something thick like lanolin. I know a lot of you are experienced with this. What do people use for their topical ointments? Do you use lanolin or cocoa butter? Lubriderm? Aquaphor? Yeah, I think that's nice. I think it has to be something that's a little bit thick and stays on the skin a little bit, not something that's going to sink right in. So the other thing is avoiding exposure to detergents, harsh detergents, and chemicals. So if you are cleaning, in the kitchen or you're doing something like that, you want to use gloves and be careful that you're not exposing your skin to abrasive type things. Massage is very helpful, can help to improve circulation, mobilize the skin, and decrease swelling and stiffness. And then using rubber gloves when washing dishes, gardening, or cleaning to avoid injuring your skin. With fingertip or joint ulcers, take precautions to avoid further irritation and infection using the fingertip protectors. I have a slide of that. Adapting your pens and other utensils with foam to reduce pressure on the sensitive fingertip areas. And writing is, I'm sure, a pretty vexing thing for some people who have calcinosis and ulcers. And there's a plethora of different types of ergonomic pens and things. And the ones I have out here are not helpful for everyone. In fact, Dr. Osterman and I decided we didn't even like the one that I brought. And they were donated to me as samples by someone who's working on a design, the ones that are in the package. But see for yourself, what works for one person isn't necessarily going to work for another. There's also a functional solutions catalog out there. It's a catalog of devices. Help yourself to take one of those. Those are, she has one right there. And there's many, many different things that you may find helpful, from jar openers and things like that.
Designed by patients who had problems.
Sorry?
Pretty much, many of the things there are designed by patients
Yes.
themselves
Right.
who said, I have a problem with this, how can I solve it?
Right. And, so the other giveaway we have is this little bottle opener. So the idea is if you have calcinosis or ulcers on the fingertips and you're trying to open a tight bottle top, that is something that can be helpful. And then I think it was Elaine who also said at the drugstore, you can get those, the easy open tops. So just keep that in mind as well.
Those are too hard.
Are
They
they
should be made soft.
softer, the tops? Yeah.
And the pens,
Mm-hmm.
that indentation.
Yeah.
That's
There's
not-
in the functional solutions, there's a foam tubing, and we have that in our therapy units. And you can just cut a piece off, you slip it onto like a Bic pen or a thin pen, and that is soft, and it enlarges the handle of the circumference of the pen. And these are really nice. Has anybody used these little silicone gel lined sleeves? These are really very nice, and I found that a lot of our patients really like them. It's basically a little finger sleeve that has a gel lining, a thin gel lining, and it's very comforting, and it provides some nice protection. Now, controlling symptoms of Raynaud's is very important, as we've heard, and symptoms are triggered by temperature changes, but also emotional changes that heighten the sympathetic nervous system, so fear and anxiety and any kind of real emotional upset. So strategies are first and foremost to avoid cold. We've heard about this. Always wear gloves in cold weather. And in the grocery store when you're picking out frozen products and things like that. And glove liners can be very helpful. Experiment to see, find different manufacturers of different gloves. Some are very, very warm and insulated. I think Eddie Bauer has a nice selection of gloves. And then using pot holders even when you're handling frozen foods and going into the fridge. And insulated mugs and glasses for hot and cold beverages. Stress management, I think, is really important. And, having a daily practice of meditation or some sort of form of relaxation is important because what it's been found to do is it reduces that sympathetic nervous activity, which then leads to dilation of your blood vessels and increase in circulation. And that's important certainly for Raynaud's, as well as just in general for healing and for your blood pressure and all kinds of things. So trying to develop a daily practice of even just 10 minutes twice a day, either deep breathing or relax or meditation. And there's lots of guided meditations too. If you have, now that there's all these apps for the phones, and there's actually a meditation app that you can, every day there's a 10-minute different type of meditation that helps you relax. And that will help to reduce that sympathetic nervous activity. So I think you really, want to explore that. The other thing is thinking about the things that cause vasoconstriction, like nicotine. So certainly you don't want to be smoking. Excessive caffeine or chocolate and antihistamine, certain things like that will cause some vasoconstriction, so you want to stay away from that. And thermal biofeedback to develop control of finger temperature. Has anybody tried that at all? Basically what that is, biofeedback is a system of enhancing your awareness of certain bodily functions. And so we use it for muscle activity, overactivity, or if we're trying to get the patient to appreciate activity in a weak muscle. But with temperature, there are little thermistors that are applied to the fingertip with a display that translates what the temperature into some sort of a display, whether it's a video game, whether it's a graph, a signal. There may be something like that. And typically it's best used with a guided meditation, and there are some out there that are specifically for warming the hands. So it's something to look forward to or look into. I think it can be very effective for Raynaud's. And then joint protection and functional retraining. We will work with our patients to develop a full home program of exercises and massage techniques and things like that. And we'll talk about how to minimize stress on the vulnerable joints and tissues based on your specific daily activities. There's a plethora, like I said, of ergonomic utensils, tools, and devices. One line that's readily available in Macy's and some of the other department stores is the OXO line. Are you familiar with that? OXO Good Grips. They're wonderfully made tools that are great for the kitchen and eating and things like that. And then you can just buy the foam tubing that you see in the Functional Solutions catalog and slip that over your toothbrush or your pens or whatever other utensils that you're having difficulty with. And so this just shows a variety of different things that might be helpful. A key holder, holding on to a tiny key for your house and your ignition can be very difficult. Button hooks, it can be very painful trying to button buttons if you have calcinosis or fingertip ulcers. And then this little gadget for opening jars, and then this is what we have outside, these little pill bottle openers. And then the other thing is self-monitoring. So just in general, in terms of your intervention with a therapist, you're not coming to therapy 3 times a week for 6 weeks to do therapy. Basically, your session with a therapist is probably about 3 sessions. One is evaluation, to set a baseline and understand what your unique needs are. The second is to come in and have a full instruction in a home program, and then activities of daily living. And then the third is like an instruction in joint protection, energy conservation. So it's a very specific targeted therapy sessions, and then you're on your own in terms of carrying these things out with periodic visits to the therapist. And so there's lots of things that ways that you can monitor yourself to make sure that you are maintaining as much as you can your mobility. So hand tracing with your fingers and thumbs spread apart and the fingers extended as far as possible, and then you can take some measurements, to see how you're maintaining that. So for example, over here, just making a hand tracing while you're spreading your thumb and your fingers apart, and then periodically just placing your hand on that to see if you can achieve that same degree of span. And then this is just a little card that can be made to measure the angle of your finger and then maintaining that. So you want to try and maintain as much extension as you can. And then how far down you can flex your fingers down on your palm is a way to monitor your MP joint flexion. And then energy conservation, work simplification. Some of this may come very naturally to some people, and some people would benefit from actually going through their day and kind of going over these things. But analyzing what you do every day and seeing if you can eliminate some unnecessary steps or tasks, combine steps, organize and plan your daily and weekly tasks, take frequent rest breaks, and organize your work areas and storage to make sure that you have everything accessible and it's for maximum convenience. And it's very important to take rest breaks to preserve your energy. You don't want to be thinking that you're just going to tough it out and try and do everything that you need to do in one shot, because then you're going to pay for it in the days after. It'll fatigue you and increase your symptoms. So just in conclusion, for therapy, you need typically a physician prescription, either your primary or rheumatologist. If you come to the hand center, typically you're seeing one of our surgeons for a baseline, and then you'd be able to be seen in our therapy units. I have brochures out front. We have the Philadelphia and South Jersey Hand Centers have 19 offices between Jersey and Pennsylvania. And so we're available to see you all. If you want, there's the Hand Therapy Certification Commission. It's htcc.org is a website where you can find therapists in your local area by entering in your zip code. And then you can find someone that way. But hand therapists typically are occupational therapists or physical therapists who specialize in treatment of the hand and arm and the upper extremity. And so that's what you want to look for. And then beyond that, finding out when you're researching this, how much experience does the individual have in treating patients with scleroderma would be helpful. What about insurance coverage? Well, many insurances pay for therapy after your deductible and or with copays. So every plan is different, and you need to research that probably before you embark on any treatment, is just find out. But you either have a copay or a deductible. Nowadays, with the high deductible health plans, there's fairly significant deductibles before your insurance kicks in, but something to be aware of. And as I said, supervised therapy, we would probably be doing supervised therapy if you had one of the surgical procedures that Dr. Osterman mentioned, because after surgery, there's many things that we're going to be focusing on, ranging from wound care, protection of fused joints, mobilization of the joints around the fused joint. If the procedure was done to increase mobility, then we're going to be doing exercises to make sure that you get the maximum benefit from the surgery that was done to increase the mobility. So therapy in that instance, post-surgically, is going to be more supervised initially, and then eventually you're off on your own with a home program. Whereas in general, pre-op therapy or non-operative therapy would be something that would be very focused, that you would do mainly at home. Okay, thank you. Anybody have any questions or anything they want to share?
Just wanted to offer something that I do at night with my hands.
Mm-hmm.
There's a product at the grocery store called Bag Balm. They put
Oh,
it
yes.
on medicated Vaseline. They put it on cows' udders in the wintertime. And I really slather my hands with that and then put cotton gloves
And put gloves on.
And
Yep.
my hands are beautiful in the morning. And an hour later, they're back to normal. But it is a great softening agent.
What is it called?
Bag Balm. It's Bag Balm.
BAGBALM. And it's in a green jar, green tin. They make little ones for travel. get
It
the
was originally developed for cows and udders. And so their udders get real sensitive if you milk them a lot. So farmers figured out that bag balm, which eventually became its trade name, would really develop from the udders.
Well,
And it
and
works.
they're moist
Yeah.
too, out in the cold, so that's contributing
Right.
to soreness.
You were saying meditation,
Meditation.
and is there a certain kind of music or CDs that?
There's different types of meditation, but mindfulness meditation is one that's gotten a lot of press for its benefit for hypertension, anxiety, depression. But I think you can get tapes and CDs, and they're guided, so that means that they take you through a process of, thinking about a body part and tensing it and relaxing it. There's one called progressive relaxation, where it basically, that's what it does, is you tense the body part to increase your awareness of it and then relax, and then it takes you through that whole process. But it's basically quieting the mind from what you're constantly thinking about throughout the day and focusing on either your breathing or a certain body part to try and calm yourself down. And it helps to increase blood flow, reduce sympathetic nervous activity, and I think in general it's very effective.
I see a massage therapist quite often, and she does my hand, and she puts her hand in mine, and
she's stretching it.
Is that an okay kind of thing?
Sure, as long as it's comfortable. The question was, Elaine goes to a massage therapist and she massages the hand and then she stretches it with her other hand. And I think it sounds fine, but the important thing is it should not be painful. So you should not be tensing up and holding your breath if you find that it's painful. Exercise in general, you don't want it to be painful. You want it to be mindful, so you're paying attention and you're holding the position at the end of the range of motion to try and increase range of motion. It doesn't work to do it quickly and just kind of go through, but it should not be painful, and you should not have lasting pain afterwards. And that, is sometimes if you're going to a practitioner, whether it's a massage therapist or a non-hand therapist who is trying to increase range of motion and stretch your joints, that's something to be aware of. It should not be painful, because if you're feeling pain, that's a signal that the tissue is stressed, and that stress can result in inflammation and greater stiffness. So it's important to be careful that way.
The graphic that you showed, the exercises to do, can we see that on the website somewhere?
You know what? I will get my presentation to Fee, and then I imagine you have a mailing list or website that we can post it on.
I was just going to ask, does anybody have those exercises written down somewhere? 'Cause I can't.
If you go to the hand center, they have handouts, but I think you have to be a patient.
Well, you know what we'll do? We'll post it somewhere, whether it's on our Hand Center or Hand Foundation website or on the Scleroderma Foundation
Certainly
website.
send some printed
And we
sheets
can
to
add a
Fee.
link, we can add your link to the site.
Yeah, we can.
Yeah, we'll link to
We can
the,
certainly do
We'll
that.
find a way.
yeah.
One thing about massage, sometimes massagers like to crack your fingers, like a shoe shine boy snapping the rag, that kind of thing, make you feel they're doing something. That's not a good thing. So if they're doing that, most massage therapists won't. But if you go to, massage, they might think that was.
Oh, it takes 2 hours from my head to my toe.
Is there a special kind of cream that you use to massage the hand or lotion?
I think a couple people mentioned bag balm. I think a thicker cream, lanolin or cocoa butter, Vaseline, even straight Vaseline has got the thickness to it and it stays on your skin. So any of those I think are fine.
They just made Vaseline with cocoa butter now.
Okay.
I just found it out in
Yeah.
stores.
And Neutrogena has, I think you can get the lanolin.
Neutrogena with a,
massage oil.
okay. The quality that you want is something that's thicker than something thin, like curry lotion that you get in the hospitals and things. It sinks right in. You want something a little thicker that's going to keep your skin moist for a period of time.
Or there's another Bioflex, Biofeed.
Okay.
What is it?
There's a bio silk.
No, yeah, it's oily,
Okay.
and
Yeah, there's a whole lot of different products out there, but I think something that's a little thicker. And what Barbara said about the wearing the gloves, putting it on, and then if your hands are looking like they're really starting to get irritated from the cold weather or whatever, doing that before you go to bed at night, just a little lotion and the...
I have two more things to share. Somebody
Sure.
gave me a little gimmick for a lid that is sealed, and you...
Oh, to crack it open kind of thing?
Then it's,
Breaks the air
it
seal.
breathes. That has been the best fridge I've ever used.
Where did you get it?
Somebody gave it to me.
It's in one of
It's
the
in the
magazines.
Oh, it's in the.
Oh, it's in there. Okay.
The other thing is that Hammacher Schlemmer makes a thing for, what's the science where you're pushing
Reflexology.
reflexology, and you put your hand in it, and it comes down pretty hard. I don't do it if I have ulcers, but it's like a hand massage. And you can do a heated one. You can make it heat, and my hand feels wonderful after I do that. I don't know whether I should be doing it or not, but it does feel awfully good.
No, that's
Okay.
fine, that machine is pretty reasonable. A little expensive, but it does a sort of acupressure type massage to the fingers. What it does is it hits the little muscles. Or most people's hands get tired of the thenar muscles and these little muscles, so your hand has this sort of organizational muscle kind of thing that really things, which a massage therapist, I'm sure yours does, massages each of those muscle groups, and that's what that machine does.
Sir?
The question was, contact information, we want to be able to contact, do you have contact information?
Yes, out on the table, we have our hand center.
Before we got to see him.
I'm sorry, I didn't hear that. I didn't
That's
hear
not the
that.
last resort.
Oh, I see. You want to see me?
Come as a team, believe it or not.
Yeah, we do. I mean, just because you come in to see Dr. Osterman or any of the surgeons, it's to establish a baseline, not because they're going to do surgery.
But usually you get a
You know.
prescription, you can't, now your family doctor can write a prescription. One of the problems that a hand center or anybody who's independent is a family doctor who's very good for your hypertension says hand pain. Well, that doesn't help the therapist as to
Right.
what the diagnosis and how to direct the hand therapy. So that usually you need somebody to screen what kind of therapy is appropriate, and that's where you need an orthopedist or a rheumatologist to really focus that referral, because hand pain to a therapist doesn't really tell them. They have to try to
Right.
figure it out. Sometimes they can, sometimes they can't. So you have to be a little careful of that. So we just made a policy that you're seen by some expert before you have an open referral to the hand center.
We really appreciate all the work you guys are doing, the tireless work. It's phenomenal.
It's very satisfying. I mean, the turnout here, it's just very satisfying because simple things can make a big difference in function and sharing. This works for me, and now you got 20 other people. It's kind of the old, teach them how to fish.
Right. Yes.
A lot of us were talking about swelling earlier. I'm wondering if for swelling and pain in the fingers, exercising obviously still okay. It hurts. So based on
Yeah.
the notion of if it hurts, don't do it. Should you still do it?
You do it within the range that you can tolerate. You could try to do some massage before you exercise. You also could try to do some meditation to try and increase the blood flow to your hands, and that may be part of the reason why you're having pain. So I would try some things prior to actually moving. Massage, in an elevated position. You can even try neutral warmth, even though that sounds paradoxical. Heat in general increases swelling, but sometimes if it reduces the discomfort that you have, and you do it with your hand elevated and you follow it up with exercises, it can be very therapeutic. You just don't want to use it indiscriminately and then see that you're just exacerbating your swelling.
Right, which has been my experience.
Yeah.
The pain, the swelling just gets worse, and I'm like, I thought this was supposed to help. And
Do you see
There
a
are
therapist?
I
I'm
was gonna say,
sorry.
there are some things like Coban, which you put around the finger joints before to help with the edema. Also, one of the things that's popular, they are not a home unit yet, but one of the things we use at the hand center is a thing called fluidotherapy, which has nothing to do with fluid. It's actually ground corn cobs. but it's a dry heat. So you put your hand in this machine and it blows these hot like feels like sand, it's like the finest sand, but it's a dry heat, so your hand's not dependent. And so that kind of dry heat, like they're doing a sauna and a steam bath, or that dry heat tends to really loosen up tissues really well. But unfortunately, there's no Hammacher Schlemmer unit for that. Not yet, anyway.
But you could consult your hand therapist or seek out a hand therapist for a session or two to just see what might work best for you. There's a bunch of different things you can try. You know, the Coband's one, isotoner gloves for light compression are very comfortable and are helpful for swelling. Yeah, but you need to be careful, you know, because if it's too tight, then you're going to exacerbate things. So you have to be careful.
One of the tricks that Terri uses also, we can measure volume. So you say, I'm swollen. We look and say it's swollen. But they're gauges and essentially meters that we can absolutely give you a number. Your hand has 570 cc's of fluid. And then if you do, for example, a series of exercises, and you go to 630, we might say, those exercises, let's cut out this, let's do this. Now you go from 570 to 530. You say, aha, that's the way you should manage your swelling. And so we can titrate. I mean, everybody says, I'm swollen. You'd be surprised. Some people are swollen, and you can't tell between one hand and the other 10 cc's a difference. We tend to think of 50 cc's as a critical number. And some people, you know, are 150 cc's. Their hand's like a Pillsbury Doughboy.
I have big hands. The men's gloves aren't shaped right, and the women's gloves are way too small. I can't find an isotoner to fit me.
Well,
I mean, I don't know who they're measuring their hands off of, but
That's where they're made.
yeah. I mean, every extra large.
there are some other
And
companies.
then if I go to the men's, they're not shaped right.
They're not shaped right. There are some other manufacturers besides Isotoner. North Coast Medical, for example, and actually I think they're the Functional Solutions catalog. They may have some things in there that are North Coast Medical. If I'm not,
They also have some, I think, some gloves for swollen hands, which would not fit the normal hand. A very funny story.
Natural big hands.
Say a very funny story. A number of years ago, when we first were doing spacewalks for NASA, the company that made the gloves for our astronauts is actually way down in Delaware. And for a spacewalk, the pair of gloves alone is about $30,000 a pair. So a little more expensive than isotoner. So our government decided, rather than, because they had different people doing spacewalks, rather than have a custom molded thing, that they would have three sizes, small, medium, and large, and then whoever's going to use them would use them. Well, the first two spacewalk that we did came back and they had no feeling in their hands because of carpal tunnel, because the gloves are pressurized. And because they didn't fit exactly, and they're so pressurized, that they essentially had no feeling in their hands for almost 6 months. So we had to get involved in a whole process. So now every ETM has a specially designed gloves. I don't think Sandra wore them in Gravity, but basically that concept. So you need good fitting gloves.
Wow. What is your feeling about these things, these stylus?
the stylus for your iPad
I
and.
use this instead of fingers on the iPad because I had shooting pains coming up the
Okay.
hands from
Was that helped with the stylus?
banging on this.
Does that
Yes,
help?
This is one of those heat sensitive
Yeah,
rubberized things.
yeah.
But you're still hitting each key. Do you know?
Yeah, I know what you mean.
So
Yeah.
I'm not sure if this is hurting too or.
Well, I think with anything, like with keyboards and with anything like that, you want to control the duration that you're doing anything. So if you're doing it, try to take a break every 15, 20 minutes, stretch or do those exercises, stretch out an extension. You know, the posture that you're holding the stylus with, you know, you want to get out of that posture and stretch your fingers out and then go back to it. The other thing is that you can build up the circumference of that stylus with that foam tube. You know, you can just slip that on, and that requires less pinch strength, and it reduces the tension in your fingers when you're holding it. So.
What about the people that have to be on a computer all day?
Mm-hmm.
Do the typing?
Well, anybody, whether you have scleroderma or not, need to be aware of some healthy hand habits with that, and there are ergonomic postures. For example, when you're at a keyboard, your wrist should be straightish. not up or not down. So you achieve that by raising or lowering your seat or your surface that you have your keyboard on. And then the other thing is to, again, control the duration that you're typing or keying for a length of time, and then taking a break and then doing some stretches.
Okay, there's a magazine I get that I've ordered things out of, it's called First Street.
Mm-hmm.
And they are pushing a whole page ad of a computer that you talk and it types in.
Yes.
I haven't gone on to see what the price is on that. It must be.
Well, it may not be as expensive as you think. I have a patient with a tendon injury that she had to stop keying for a period of time, and she's using it's Dragon. Are you familiar with that? And she thinks it works great. I mean, initially when these voice-activated things came out, they were not all that accurate or effective, but I think there's been a lot of improvement in that. But certainly voice-activated, keyboarding.
It still can be frustrating. I mean, not everybody's looking for the perfect, interface solution to that. And even Dragon 12, which is the newest iteration, and even training in terms of pronunciation, it can recognize simple things. But if you're really doing a dictation, it hasn't replaced the secretary yet in terms of automatically transmitting what you say and just picking up, because it mistakes words. Or it'll write a whole paragraph, and so you'll suddenly say, you said socks, and they said sex. And that goes out to the family doctor. She has trouble. I had trouble helping her with her socks, and it comes out like that. And pretty soon you don't look so sweet on the process. So you have to be a little worried about it.
Your iPhone?
Correcting what I'm spelling.
When you're you're
if I look
doing
back, they changed what I was writing.
it. Yep. You have to be careful.
Crazy.
Yes.
I have a question probably for both of you. What's the average recovery time? The person went for a joint replacement. And secondly, is the hand immobilized during that recovery period?
Well, we try to keep moving parts moving. That's what the hand is. And obviously a fusion we're not. It varies depending on the circulation of the digits. Some digits get fused because of infections, poor circulation, etc. As you saw Terri splints, when we have a PIP fusion, we want your MP, your knuckle joint moving, we want your tip joint moving, we want your wrist moving. And so after about the first week, we try to put you in a small splint. Usually they're pins which are protruding. One of the problems, we do fusions in all kinds of arthritis. One of the problems with scleroderma is you don't have any room to put any internal hardware, and that's a real problem that we're also trying to work out a solution to. You don't have skin breadth underneath it, so pins have to stick out. Well, that's very annoying, because you've got a pin sticking out of your finger. You look like Freddy Krueger, for 6 weeks while the pin is sticking out. And the chances for infection are a little higher when you have exposed hardware in a finger which doesn't have the best circulation. But most people can get back with, say, MP or wrist replacements back to light daily activities, driving, light emails, etc., by about 6 weeks with the major MP wrist procedures. Fusion, as soon as you feel comfortable, we let you use it because we have an internal plate there. For PIP fusions, if we have to do something where it's exposed, you have to protect the pin until that comes out for 6 weeks. If we put it inside, we let you use it as soon as you feel comfortable to use it with just a little protection around it, be it co-band or a tiny little splint. But most surgery takes longer to recover from than the surgeon tells the patient. We just underestimate everybody, and we generally say about 6 or 8 weeks gets you back to light ADL as a general rule, depending on what the procedure is.
Thank you.
You said not to crack your knuckles.
But don't have the therapist crack them.
Don't have the therapist crack them. Whenever I move, my ankles crack.
Well, but noises, joint noises can be, people that are loose jointed have lots of joint noises. We don't care about joint noises usually unless they're painful. But for example, having somebody crack your fingers, you're stressing the tissues to kind of get that crack. That's different than you moving your hand and it cracks, or your shoulder makes a click when you move it. people that crack their knuckles do not, we studied that, don't have an increased incidence of arthritis. They don't have arthritis, but these people who kind of crack their knuckles all the time because it feels better or a nervous habit, they do not develop arthritis in those joints, but they develop a thicker joint. The ligaments actually get thicker, so that 20 years of doing that, your wedding ring will have to be enlarged by about 2 sizes. But it doesn't cause arthritis of the joint. It causes a thickening of the ligament around the joint. You don't need.
Very good, thank you all, thank you so much, Terry. And if you